We traveled to St. Francis County to work on Missouri Million Hearts Initiative. Million Hearts was started in Ohio State University. This program organizes individuals with different backgrounds in order to draw attention to and improve cardiovascular outcomes. Missouri Million Hearts is the Missouri branch, which strives to save 20,000 Missourian hearts. Along with representatives from the state and local DHSS, we visited 2 work sites to do free screenings for employees to provide them with education about how to improve their cardiovascular health. We also gave a presentation to a local health coalition, a group of healthcare providers and residents of the community who are working to improve health outcomes in their area. St. Francis County has some of the worst cardiovascular health in the state. On top of that, Missouri has some of the worst cardiovascular health in the country. There is a significant lack of resources in this community. A large majority of the community members are not educated about how to improve their health and how their behavior is impacting their health. Missouri provides the least amount of money per capita of any state in this country. This means there is a huge need for voluntary services provided by various healthcare providers. By providing these cardiovascular screenings and education to the members of this community, we helped fill this gap in resources for an underserved area of the state. It is critical that we educate our population prior to having the negative outcomes of the behaviors. Our society currently operates on a sick care system rather than a health care system. We often do not see or serve these patients until they are critically ill. By providing education, we can decrease the number of people who need to be hospitalized, thus decreasing healthcare costs. This is especially important in St. Francis County, where 16% of people are uninsured. In order to complete the free screenings, we gathered resources such as stethoscopes, blood pressure cuffs, glucometers, cholesterol testing machines, and hemoglobin A1C machines. Many of these resources were provided by the St. Francis Health Department and the Sim Lab at the School of Nursing. The State Health Department provided goodie bags as well as handouts giving information about local resources for the individuals. The individuals that we screened were very grateful for the information that we provided them. Some people received information that they were not happy about because it meant that they had to follow up with a healthcare provider. However, some people received good news that encouraged them to continue making changes in their health. For example, one woman stated that this was the best news she's had all month. In addition, the local and state health departments were very grateful for our help and feedback. We were the first group to go and do these screenings with Missouri Million Hearts, so we were able to provide constructive criticism and give insight to ways that the process could be improved in the future. This project requires a significant amount of manpower, and we were able to provide that and complete the screenings efficiently. The Health Coalition showed support for our project as well. We provided some data about the ranking of the county in areas that needed improvement in order to decrease poor cardiovascular health outcomes in their community. Although it was shocking for some members to see that their county was ranked 95th out of 104 counties in Missouri, it was beneficial for them to learn the information so that they could focus their efforts on the areas that needed the most improvement, such as food scarcity and smoking. This project could be improved by including more students and multiple communities during the semester. It was beneficial for the people of St. Francis County and was a great learning experience for us as nursing students. If the budget allowed it, it would be a good program to expand and continue for future students. We enjoyed seeing how many different people can come together to focus on a common goal, in this case, improving cardiovascular health outcomes in our state. It is easy to make judgments of individuals who make choices we know to be poor for your health, like smoking, inactivity, and eating fast food frequently. However, after being in the community where they live, it is easy to see why they make some of these decisions. Some resources, such as safe areas to exercise or healthy food options, are just not available or accessible where they live. In addition, many people are not educated about the risks that their decisions pose to their health. This has opened our eyes about how challenging it is for people to make healthy choices when living in poverty, and will be more understanding of our future patients.